Yeah, again, the subtype of melanoma, which is mostly predetermined by the site of origin, drives those considerations. So other genes are, as you mentioned, NRAS. NRAS, there are mutations primarily at codon 61 and 1213. And those are clearly pathogenic mutations that account for maybe a quarter of all melanomas. There's no current agent to directly treat those, but there are multiple clinical trials pursuing various therapeutic options downstream of mutant NRAS. Then there are kind of genes in similar categories like GNAQ, GNA11 mutations in uveal melanoma, melanoma arising the inside of the eye. Those also are not actionable in the strict sense, similar to NRAS, in that they are not targetable directly, but there are various clinical trials that evaluate therapeutic targets downstream of those oncoproteins. Then there are mutations in KIT, activating mutations in a subset of melanomas. They're more common in melanomas that originate from acral sites, so the non-hair-bearing skin of the palms and soles, nail apparatus, mucosal membranes, and also a small proportion of melanomas originating from chronically sun-damaged skin has KIT mutations. Those are actionable. There are multiple clinical trials that show that KIT inhibitors have a positive effect on patients with melanomas that have KIT mutations. Then there are these gene fusions. I mentioned BRAF is one of those, but there are also fusions in other kinases such as ALK, ROS1, NTRK1, and those are kind of therapeutic targets that are on the horizon. Their frequency is difficult to estimate at this point in time because there are no really standardized assays so that one can actually get a firm sense of how common these are. But if after testing for these main drivers in melanomas, one still doesn't find a driving mutation, one should be aware of the possibility that there may be a fusion underlying this process as a driver. Kind of one gene that I forgot to mention that is frequently mutated, in particular in melanomas arising on chronically sun-exposed skin, is NF1. These are loss-of-function mutations. They're difficult to test for because it's a very large gene, and so this is definitely currently out of range of these more focused testing approaches.